Hi, Madeleine Lowry here, Nutritional Therapy Practitioner. And I wanted to talk about allergies and sensitivities, the nutritional therapy approach to allergies and sensitivities in this video. So, one of the things nutritional therapists get trained in is how to help people identify their hidden food sensitivities. Allergies are usually easier because allergies, there's this immediate onset. You're exposed to some food substance and or spice, and you have an immediate reaction to that, right? Whether it's itching or swelling or sneezing or something else. But when it comes to hidden food sensitivities, well, we call them hidden because these are more chronic types of symptoms, and the symptoms can show up 24, 48, even 72 hours after you've consumed that food. So they are, hidden in a sense that the connection is often not made between the consumption of that food or that spice and then the symptoms showing up. There are many possible symptoms that can result from a food sensitivity or intolerance. And these can range from a respiratory, like sneezing, um, shortness of breath, asthma, could be you might have a runny nose or a stuffy nose. You might have itchy eyes. You could have itchiness, can affect your skin. You might have rashes. It can affect your inner ear. You might have dizziness or vertigo. Um, you could have intestinal distress due to the consumption of a food that you're intolerant to. Really, so many things. I mean, joint pain, migraines, headaches, those are also very common. Heart palpitations. I could go on and on. Um, but so the important thing is that we figure out what if you have hidden food sensitivities, and then what those foods are, and then we typically ask you to eliminate those foods for 2 or 3 weeks to see if your symptoms will subside. So the nutritional therapy method of testing involves pulse changes in response to exposure to that food. You put a food on the tongue and then take a baseline pulse before and then compare it to the pulse after. But I found that method was actually just too time consuming, and I pursued additional skills in energy kinesiology so that I could test people against a test kit that I have of a few hundred food substances in a 1 hour visit. So I actually do this hands-on testing in the office, and I send people home with a list of the foods that they seem to be sensitive to. So these are suspected sensitivities. It's not like a lab test; it's just an indication. But I do ask that they try to eliminate the foods from their diet and see what happens for them. Sometimes within a matter of days or weeks, um, their troublesome symptoms dissipate, and so that's a really clear sign for us that we have found something. It may not be the whole list, right? But after 2 or 3 weeks, um, you know, we can start to assess which foods might be possible to bring back into the diet, and then those are reintroduced one by one, say every 3 to 4 days. There's a protocol for that I send clients home with. So that's the traditional nutritional therapy approach with my own little twist of using energy kinesiology, so I can test people against more food items in a shorter period of time. But I have also sort of, as I started to see more and more people with allergies and sensitivities, and the food intolerance lists were getting longer and longer, I decided that I really needed some more tools, because many people are quite dismayed when they leave with a list of 12 or 15 foods that they have to eliminate, and possibly for the long term. And so I started to look into allergy elimination techniques. So in my next video, we're going to talk about some allergy elimination techniques, and particularly focusing on the idea of neural retraining for allergies and sensitivities. So join me for that one. Thanks.